Hi, it's Dr. Davidson, Revolution Aesthetics, and today what we're going to do is continue the coronavirus series and talk about a couple of things that's come up through the week and hopefully dispel a couple of rumours at the same time. So today we're going to talk about PPE, personal protective equipment, and also address the idea that hospitals, A&Es aren't very busy at the moment. So PPE, what is it? It's personal protective equipment. Now I've seen some gas masks, some scarves, some gloves, over the past couple of weeks really, to all types of uses. But do we need this type of gear? Well, interestingly enough, the Chinese government have now enforced the use of wearing a mask every time they leave the doors or go outside. Now, this isn't something that we've enlisted or enforced here in the UK, but remember, we're on lockdown. So there's no unnecessary visits. It's essential travel only and to provide help and aid to those who are vulnerable. This isn't to say that an extra level of protection might be needed for those who are more vulnerable than the majority of us. Remember, those people who are invited for a flu jab once a year, those people who are advised to stay indoors for 3 months. But for the main and for the majority, social distancing is still the one. It's still the key. I mean, let's remember the virus is droplet borne, it's not airborne. So keeping that distance away from people is still the most important thing to do. Good hand hygiene, making sure and trying to reduce the amount that we're coughing and spluttering out in the community as well. So where might we see more PPE being used? Now we're going to see it in our frontline staff and those members of the community who have to undertake a bit more risk from those people who may or may not have symptoms of this virus. In particular, we're going to see it a lot in doctors and nurses and those of people who are in and working in the hospital. Normally a surgical mask, just a normal mask to cover the nose and the mouth. Remember those mucous membranes we're trying to protect. And then for the main critical care unit workers, they're going to need what you might see on TV, a full dressed PPE, personal protective equipment outfit really. They've got goggles, a visor, they've got a mask that's a bit more complex and specific to the type of droplets that we might associate with coronavirus. So you might have heard FFP being used sometimes in the description. They're going to have a full apron, gloves, something to pull over footwear as well. And that's to reduce any form of exposed area to these droplets. And this needs to continue. It can give you an idea as to the number of PPE masks and equipment and gowns that we're going to need, because ideally you're supposed to change this after every patient or after every person you see. So it should give us some indication into the vast numbers and quantities and volumes that we're required to be supplied. And that's why we've struggled so much over the past few weeks. But as we begin to struggle with getting this curve down, and particularly the death rate, which we're all worried about, things might change for the majority of us out here in the community. But for now, it's the isolation rules, it's the quarantining rules, it's the social distancing rules that are still going to be at play. So now let's think a bit more about the idea that A&Es and hospitals might not be as busy. I've seen a couple of videos on social media over the past couple of weeks. Let me assure you that particularly in the units that I'm working in general practice and in the emergency setting as well, the A&Es might have been a little less hectic over the past couple of weeks, which is great because it gives an idea, an indication that the majority of people are actually managing self-care practices themselves at home. But that number's certainly coming back, and I can assure you that the wards, and particularly the critical care units where we need the beds and the space for those people that might need ventilator support, they're very busy. If you think of the NHS like a pipe, any reduction that we can get in the front will help the bursting seams at the back, and that's the wards, that's the ITU units, the critical care units at the moment. So anything we can do as a community to reduce the amount that we're coming in through the front door, expecting beds for things that maybe we can manage or hold off on, is key, because you can see loads of streams of diversion already. Outpatients, perhaps surgeries are being cancelled. So a lot of resources are being diverted to this effort. And hopefully it will continue and begin to get on top of this curve that we're trying to beat and brace down. Remember, as always, community support is key, and keep safe, look after each other.